Sickness is not a random roll of the dice. In medical astrology, physical illness is simply a mismanagement of energy on a mental or emotional level. To see how this works, you look to the birth chart. The zodiac sign a planet sits in dictates where an illness occurs. For instance, Gemini rules the lungs. The astrological house that planet occupies suggests why the ailment developed in the first place. But knowing the where and why doesn't tell you how severe the sickness will be. For that, you have to look at the body's cosmic plumbing, specifically the exact geometric angles formed between the planets. These are called hard aspects. When cosmic energy tries to flow through the body, these hard aspects act as geometric roadblocks. They block the current, creating friction that eventually manifests as physical illness and severe nutritional deficiencies. Your astrological chart provides a structural map of your body's mechanical vulnerabilities and failing pressure points. Let's look at the mechanics of these blocks. The first is the 0-degree conjunction. This happens when two planets align perfectly, melding their energies together. It creates a massive overflow, doubling the body's nutritional needs and rapidly draining your vitality. This diagram illustrates the next block, the 90-degree square. As you can see in the top panel, a square acts like a severe kink in a pipe. This sharp angle creates internal tension and restricts flow, leading to the rapid loss or overuse of specific vitamins in the body. In the middle panel, we see the 180-degree opposition, a head-on collision. One planet receives entirely too much energy, starving the other of the specific nutrient it rules. The body enters a brutal tug-of-war over resources. Because the disruption is so extreme, it manifests as a highly visible symptom of vitamin deficiency. Despite the physical stress they cause, both the square and the opposition are manageable. They serve as loud, flashing warning signs. The geometries of 90 and 180 degrees are solvable equations. They alert the body to internal friction long before it reaches a state of critical failure. With a clear symptom identified, you can fix the problem with a simple dietary correction. Then we reach the climax of the hard aspects, the 150-degree inconjunct. This is the most dangerous, impregnable astrological configuration you can deal with. In the diagram's bottom panel, the inconjunct manifests as a sealed vessel. Physically, it causes total malabsorption of B-complex vitamins. The body starves regardless of consumption. Psychologically, it represents a buildup of repressed emotions with absolutely no escape valve. The accumulating steam of these physical and mental blockages gets trapped, and a system under constant, unrelieved pressure cannot hold itself together indefinitely. Because the energy cannot flow and the nutrients cannot absorb, the internal pressure eventually explodes. This eruption usually takes the form of a severe, incredibly hard to diagnose disease. The inconjunct demonstrates that when a system lacks an outlet for its internal pressure, the resulting breakdown of metabolic function isn't a strike of fate, but a mechanical consequence. If an inconjunct is a sealed pressure cooker, how do you find the release valve to survive it? To open the valve, medical astrology points to one specific behavior: adaptation. Since the blockage is often rooted in an inflexible internal state, consciously shifting your attitude to fit your environment prevents that mental pressure from solidifying into the physical roadblock that causes malabsorption. Because these astrological blocks are geometric and highly predictable, they don't have to be a mystery. A nutritionally conscious physician can read them as exact diagnostic blueprints. Take a look at this flowchart. An astrological configuration like a Sun-Saturn block directly points a physician toward a targeted vitamin D intervention, bypassing months of guesswork and lab tests. Through the lens of medical astrology, sickness is never a random strike of bad luck. It is a strict physical demand for you to adapt to your own internal geometry. When we stop fighting our cosmic roadblocks and start supplying the body with exactly what the chart demands, the tension breaks, the energy flows, and when the energy flows, the disease goes.